Hey guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be going over NCLEX questions and basically just teaching you how to eliminate answers and how to choose the correct answer. Guys, if you haven't done so already, please be sure to press that like and subscribe button below. Guys, when you subscribe, when you like my videos, that is what keeps the content coming. So please be sure to do so. So we're going to just jump right into the questions. So the first question, the nurse is writing a standard of care for clients immediately following bone marrow transplant. Which of the following nursing diagnoses should receive priority? 1, social isolation. 2, risk for infection. 3, pain. Or 4, high risk for injury, graft versus host disease. And I'll give you a moment to think of your answer. And guys, the number 1 priority is number 2, high risk for infection. Remember, I taught you in my, which video? In the priorities video, right? I taught you in the priorities video that any patient that comes from surgery, there are 3 major priorities that you are worried about. If a patient had surgery, I don't care what kind of surgery that patient had. You're concerned about infection, you're concerned about hemorrhage, and you're concerned about that patient developing a pulmonary embolism or a DVT, okay? So obviously, the concern that we're going to have for this patient that is going to have bone marrow transplant is risk for infection. That's what we're concerned about the most. Number 2, the physician orders all of the following procedures for a client diagnosed with placenta previa. Which one should the nurse question? 1, take vital signs every 30 minutes. 2, auscultate fetal tones every 15 minutes. 3, perform vaginal checks to determine cervical dilation. 4, assess frequency, intensity, and duration of contractions. And I'll give you a moment to think of your answer. The correct answer, guys, is 3. You do not want to check the cervix, okay? That patient has placenta previa, okay? So placenta previa is when the cervix is weak, because look, the cervix is supposed to be closed. It's supposed to be closed because that's what keeps the baby inside of the womb. But if that cervix is weak and it starts to open up, the baby will do what? Slip right through, which is a medical emergency. So if a patient has placenta previa, the last thing you want to do is stick your fingers in the vagina where that cervix is weak, and you might make it even weaker. You might make it open up. So if a patient has placenta previa, you are not sticking your finger in the vagina. So of course, that's the correct answer. You're going to question that order. Number 3, an important short-term goal for the nurse to plan with a suicidal client would be for the client to 1, explore the motivating factors for suicide. 2, develop with more adaptive family relationships. 3, sign a contract that he will not act on his suicide plans. 4, no longer verbalize thoughts or feelings as they relate to suicide. And I'll give you a moment to think of their answer. Guys, the correct answer is the contract. And I know that sounds crazy, right? Having them sign the contract that they're not going to kill themselves. But evidence-based practice has shown that it works. It's very effective. Okay, so when the patient's admitted for depression, they're admitted to the facility for suicidal ideation. Upon admission, you have the patient sign a suicide contract, and this contract that says, I promise while I'm inpatient, I will not kill myself. And what happens is psychologically, the fact that they sign their name on the document, many patients actually do not commit suicide because of that, okay? So I know it sounds weird, but that's what you want to do. You want to have them sign a no suicide contract. Next question. A morbidly obese client is being prepared for gastric reduction. Which of the following is most critical to include in the nurse's care plan for this client? 1, turn, cough, deep breathing exercise. 2, identifying post-op diet modifications. 3, discussing pain control measures. 4, teaching the proper technique for ankle and leg exercises. And I'll give you a moment to think of your answer. And the correct answer is the turn, cough, deep breathe. Guys, remember, I told you, if a patient has surgery, I don't care what kind of surgery they have, we have 3 things we're worried about. Those are our priority. Infection, hemorrhage, DVT, and PE. Well, guess what? When you have that patient turn, cough, deep breathe, what are you doing? You're having that patient expand their lungs. Why? You want to prevent infection, such as what? Pneumonia. Okay? That's where your critical thinking comes in, guys. So you say to yourself, okay, I know this patient just came from surgery. I know that my 3 priorities is infection, DVT, PE, and hemorrhage. What is a priority for this patient? And it's right there, turn, cough, deep, breathe. That's why you're making that patient turn, cough, deep, breathe. You're making them move around because you want circulation, because guess what? When blood moves, it doesn't clot. So the patient can't get a DVT. DVT starts moving and it turns into a pulmonary embolism, right? When you have them deep breathe, you're having them expand the lungs. So what? That they don't get pneumonia, okay? Which is what? An infection. So guys, this is where your critical thinking comes in, all right? Next question. To help establish a diagnosis of preterm labor, the nurse should ask the client, which of the following questions? 1, how many months pregnant are you? 2, are you having any contractions? 3, have you ever been pregnant? Or 4, are you taking medications for hypertension? And I'll give you a moment to think of your answer. Guys, and the correct answer is 1. The only way you can know if a patient's in preterm labor is to know how far along they are. So you're going to ask them, how many months pregnant are you? And just so you know, guys, preterm labor is when the woman goes into labor after 20 weeks, okay? So the baby has to, the fetus, has to be at least 20 weeks old, but before 37 weeks. So if that fetus is between 20 and 37 weeks and mom is going into labor, that's what's known as preterm labor, okay? And the only way you're going to know if mom is in preterm labor is to know how far along she is. Next question. A 5-year-old child has been admitted to the hospital with a diagnosis of dehydration. The physician orders IV fluid containing potassium chloride. Which of the following actions does the nurse take first? 1, obtain their weight. 2, assess urinary output. 3, monitor skin turgor. Or 4, take vital signs. And I'll give you a minute to think of your answer. And the correct answer, guys, is to check urine output, which is number 2. I want you to think about it. This patient is getting fluid. They're getting potassium chloride. Remember, potassium, the level's supposed to be 3.5 to 5. Anything less than 3 or anything more than 5 can what? Kill the patient. So guess what? If a patient's getting a medication that has such a narrow therapeutic index, narrow therapeutic index means that the therapeutic level is very, 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 very slim. Okay, so it's very easy for that patient to go into toxicity for you to kill them, okay? And potassium is one of those medications. It has a very narrow therapeutic range, 3.5 to 5. That's not much to work with, right? So if a patient's getting medication like that, you better be checking their urine output. Why? Because if those kidneys are not working and that patient's not urinating, guess what? That potassium is going to stay in their body and it's going to build up. So here you have a patient that originally, the potassium was great, but the kidneys aren't working. They're not urinating. They're not getting rid of that potassium. And before you know it, that patient goes in potassium toxicity. And guys, you know what potassium does? It messes with what? The heart. You could give that little child a heart attack. So you better, any medication that has a narrow therapeutic index that you have to be watching the lab values, you better make sure that that patient is urinating. You better make sure that their output is at least, and that's the key number, guys, 30 mLs per hour. Patient's urine output must be at least 30 mLs per hour. And if it's not, you better hold that medication, call the doctor and say, hey, this patient's not urinating. What do you want to do with this order? Okay. Next question. Client is constantly pacing, talking rapidly to everyone, and always standing around the nurse's station. The client makes unreasonable demands on the staff and eats and sleeps infrequently. Which of the following best describes the manic behavior exhibited by this client? 1, stereotypical response to anxiety. 2, a retreat into personal inner world. 3, blunted sensory perception reactions. Or 4, an exaggerated reaction to stimuli. And I'll give you a moment. And the correction is 4, that patient's exhibiting an exaggerated response to stimuli. He's doing all of this stuff when? At the nurse's station or with staff members, right? So he has an exaggerated response to stimuli. You see choices 1, 2, and 3, which are the opposites. As a student, you should have said to yourself, let's say you didn't even know what the answer was. You should have said to yourself, well, you know what? 1, 2, and 3 all have something in common. 1, 2, and 3 all have that patient what's that word I'm looking for? Retreating. That person's retreating. And that's not what the question's saying. This person's not retreating. They're all up in your face. They're all up in everybody's face. They're all up in the nurse's station, right? So 1, 2, and 3 are the opposite. So you should have said to yourself, even if you didn't know the correct answer, wow, 1, 2, and 3 are all the same. My answer must be 4. Okay? Next question, number 13. The nurse will be admitting a mechanically ventilated client to the step-down unit. To meet the goal of maintaining the client's safety, which of the following measures does the nurse plan to do? 1, set the ventilator alarm at the lowest setting, at the lowest volume. 2, place a manual resuscitation bag at the head of the bed. 3, restrain the wrist bilaterally. 4, suction the client's endotracheal tube hourly. And I'll give you a moment to think of your answer. Guys, the correct answer is 2. For safety, you better have a resuscitation bag right next to that bedside in case something happens to that ventilator and it stops working. That patient's going to stop breathing. So you want to have that resuscitation bag right there at the patient's bedside. Now, I want to go over the other choices so you can understand why the other choices are wrong. You have number 1 that says set the ventilator alarm to the lowest setting. Excuse me? If you set that ventilator to the lowest setting and that patient stops breathing, how are you even going to hear the alarm? How are you even going to know something's wrong with that patient? So as a student, you should have got rid of that. Then you have number 3, restrain the wrist bilaterally. Why? There's no need. That patient's ventilated. Why do you need to restrain them? No. Then you have 4, suction the client's endotracheal tube hourly. And guys, this is a concept you have to know in nursing. You do not suction routinely. Because every time you suction a patient, guess what you're taking away from them? Oxygen. You only suction as needed. You don't suction routinely. Okay, so we know that was not the answer. So we're going to move on to the next question. A client was admitted to the hospital 2 days ago with a diagnosis of a manic episode of bipolar disorder. On entering the day room, the nurse finds the client dancing to the radio. The nurse's most appropriate response would be 1, please turn the radio off so we can hear each other talk. 2, you and I had planned to talk this morning. Let's go to your room. 3, how are you ever going to get any rest if you keep that music on? 4, do you think you could sit for a few minutes so we could talk? And I'll give you a moment to think of your answer. The correct answer is 2. You and I planned to talk this morning. Let's go to your room. Now, let me explain to you why the other answers are incorrect. You have number 1. It says, please turn off the radio so we can talk to each other. Number 1, that's not therapeutic. Number 2, that patient's in the patio, dancing. That's not where you want to talk. You want to give that patient privacy. So we're going to get rid of that answer. 3 and 4 are close-ended questions. They're not therapeutic, so you're going to throw them out. How are you ever going to get any rest? Turn it off? No. And the other one says, do you think you could sit down for a few minutes so we could talk? That's a yes or no question. That's a closed-ended question. No, so you want number 2. You're going to tell the patient, remember, we plan to talk. Let's go to your room. So you're reminding them that there was a plan to talk, and you're going to go to the patient's room to afford them privacy so you guys can speak. Next question. A 6-year-old client has been receiving chemotherapy for 2 weeks. The laboratory results show a platelet count of 20,000. A priority nursing implementation is to 1, encourage quiet play. 2, avoid persons with infections. 3, administer as needed oxygen. Or 4, provide foods high in iron. And I'll give you a moment to think of your answer. The correct answer, guys, is encourage quiet play. In this question, that patient's platelets is 20,000. Guys, the normal range is 150 to 450,000. Okay, 150,000 to 450,000 is the normal platelet range. Okay, remember, platelets are what keeps the patient from bleeding out. So if this patient's only at 20, they're at high risk for what? Bleeding. Hemorrhaging. So we want the child to play quietly. We don't want them to be rambunctious because we don't want them to hurt themselves, because one bump against a wall might cause them to have internal bleeding. Okay, I want you to pay attention to the age of the child. The child is 6 years old. Remember, the work of the child is what? Play. Okay, so that's another key. That was another clue to tell you what that answer was. You're going to have that child play quietly. Why? We don't want them to get hurt because they're going to bleed very easily. Now I want to go over the other choices. Avoid persons with infections. That would be an answer for patients who WBCs were very low. Your WBC is supposed to be 5,000 to 10,000. So if the patient's WBC is less than 5,000, that means they're at risk for infection, so you want to keep them away from sick people, okay? 3, administer as needed oxygen. That would be for patients whose O2 sats are low, right? You want your O2 sats, preferably you want it 98 to 100. But if it's some textbooks say 95 to 100. If it's 95, we'll still take it. But anything less than that, you'll want to give them supplemental oxygen. But that's not what's happening with our patient. And the last choice was provide foods high in iron. Well, platelets have nothing to do with iron. You would provide foods high in iron if the patient's iron levels were low, right? So that's that question. We'll move on to the next. One of the major assessment factors used by the nurse to determine the need to hospitalize a suicidal client is the client's 1, understanding of the meaning of the crisis, 2, inability to mobilize effective coping strategies, 3, expression of loud and opinionated behavior, 4, ability to express feelings about the crisis. And I'll give you guys a moment. And the correct answer is 2, inability to mobilize effective coping strategies. So this question is asking us, guys, which patient with suicidal ideation would we have to hospitalize? And it would be that patient that doesn't have coping strategies, okay? That patient that doesn't have coping strategies, they don't see any way out except for death. I want to give you an example. I want to show you the other choices. You have number 1, they understand the meaning of the crisis. So they're able to process what they're going through and they can understand what they're going through, okay? Then you have 3, expression of loud and opinionated behavior. That's good because they're expressing their opinions and their thought process, so they're getting it all out instead of keeping it in. Right? And then you have 4, ability to express feelings about the crisis. That's wonderful. They're expressing how they feel. So anytime you have a patient that's depressed, but they start expressing anger or any types of feelings, that's a good thing. Why? Because let me tell you what depression is. Depression is anger and hostility and aggression turned towards themselves. I'm so dumb. I'm so stupid. I'm lame. What's wrong with me? How come everyone's successful and I'm not? It's anger towards themselves. So when you see that patient starts to exhibit anger or any types of emotion or feelings, but they start to talk about it and they have opinions, that's a good thing. Why? Because remember, that patient thought they were lame. That's why they weren't even speaking. You know, they wouldn't speak, they wouldn't socialize because they didn't think they were worthy of socialization. But the minute they start to express themselves, what does that mean? That means they see value in themselves, right? And they're important enough that they think others should know how they feel. So that's how we got to the correct answer of 2, because all the other choices were showing, even though the patient was depressed, even though the patient was suicidal, right? They were expressing, or in some kind of way, they're expressing their feelings, which is a good thing. But number 2, that patient that cannot, they have no coping strategies whatsoever. They're not crying. They're not talking about their feelings. They're not getting it out. They're the ones that need to be admitted, okay? Because they're at highest risk for suicide. All right, next question. Which of the following statements by the nurse best describes magnesium sulfate's course of action on the client with pregnancy-induced hypertension? Magnesium sulfate, 1, acts as a CNS depressant that results in overall systemic vasodilation. 2, stimulates increased production of renin and angiotensin, which decreases blood pressure. 3, acts as a tranquilizer, which decreases the risk of seizure. Or 4, enhances renal function by affecting tubular secretion and reabsorption. And I'll give you a moment to think of your answer. Guys, the correct answer is 1. It acts as a CNS depressant that results in overall systemic vasodilation. And that's the reason we love magnesium sulfate in OB, because if that patient has pregnancy-induced hypertension, her blood pressure is through the roof, right? We can give them the magnesium sulfate, and because the magnesium sulfate, what it causes vasodilation. It dilates all of the vessels, which makes the blood pressure do what? Go down, okay? Which is a great thing. Something else I wanted to tell you about magnesium sulfate. Remember, yes, magnesium sulfate causes vasodilation, brings down the blood pressure, but another wonderful thing that it does, it relaxes the smooth muscles, right? So if a patient has an irritated uterus, this patient's having contractions, and they're having contractions too soon, right? What does the magnesium sulfate do? Relax those muscles that are causing the contractions. So whenever you're giving a patient magnesium sulfate, one of the things you better be doing is checking their deep tendon reflexes, checking the muscle reflexes, because remember, you don't want to give too much magnesium sulfate, because if it works too much, what is it doing? It's relaxing those muscles too much, and then now we have a whole set of different issues. I'll talk to you more about that on my OB video. So the correct answer was number 1. It causes vasodilation and brings down the blood pressure. In planning a menu for a client suffering from acute manic episode, which of the following would the nurse determine to be most appropriate? 1, spaghetti meatball, salad, banana. 2, beef and vegetable stew, bread, vanilla pudding. 3, fried chicken leg, ear of corn, apple. Or 4, fish fillets, stewed tomatoes, cake. And I'll give you a moment to think of your answer. And the correct answer is 3, guys. Fried chicken leg, ear of corn, apple. Let me explain to you why. These patients that are bipolar and in the manic phase, they're going. They are going a million miles a minute. They're all over the place because they're hyper excited, okay? They're in the manic phase. So their brain is going a million miles an hour. Their body is going a million miles an hour. Their heart rate is going a million miles an hour. Their blood pressure is going a million miles an hour. Everything is up. They're all over the place. They're talking a mile a minute. They're all up in your face. These patients are annoying. They won't shut up. They won't stop moving. So guess what? The reason fried chicken leg, ear of corn, and apples is the answer is because those are all foods the patient can eat while they're walking around. Because remember, when the patient's in the manic phase, they're not stopping to take a break. But you still got to give them nutrition, right? Remember, nutrition is a priority. Guys, if you haven't watched my priority video, make sure you watch it. You will understand nutrition is a priority. So when it comes to these manic patients, you have to be able to feed them, and they're not going to sit down to eat. So look at these other choices. Spaghetti and meatballs, you got to sit down to eat that. Beef and vegetable stew, you got to sit down to eat that. Stewed tomatoes, cake, fish fillet, you have to sit down to eat that. But a chicken leg, you can hold that. Corn, you can hold that. An apple, you can hold that and run all over the place, which is what that patient's doing. Remember, that patient's in the manic phase. They're all over the place. They're burning a whole lot of calories. So you have to be able to replace those calories. How are you going to replace it? By giving the patient finger foods, by giving them foods that they can walk around in. Okay? Next question. A child with a radial fracture complains of itching to the casted area. The appropriate nursing action to relieve itching is to 1, allow the child to use the Q-tip to scratch the area. 2, visualize the toes and area above the cast to identify areas of irritation. 3, apply ice pack for 10 to 15 minutes. 4, explain to the child that itching is an indication the fracture is healing. And I'll give you a moment to think of your answer. The correct answer, guys, is 3, the ice pack. Something else that you can do for the patient if they have a cast and they're itching, you can take a blow dryer, put it on cool setting, and blow inside where their arm is, where the skin is, between the skin and the cast. That can relieve the itching. Under no circumstances should the child ever, or anybody ever, stick anything into the cast. And what kids like to do, they like to take a ruler, or they like to take a hanger or something, and they'll stick it in the cast and they'll scratch their skin. Here's the problem with that. When they're scratching that itch, remember they have a cast. So there's really not much air circulation. If that skin breaks open, right, that's a perfect environment for bacteria to set in. And now we have a completely other set of problem on our hands. So no one, if a patient has a cast, they should never stick anything inside the cast, okay? If the patient says itching, you could put either cold ice pack on top of it, or you can use a blow dryer and put it on cool setting. Next question. A depressed client attends activity therapy and is encouraged to pound designs into a leather belt. This intervention is based on which theory of depression? 1, aggression turned inward model. 2, associative looseness model. 3, object loss model. Or 4, learned helplessness model. And I'll give you a moment to think of your answer. And the correct answer, guys, is 1. Remember, I told you, patients that are depressed, they have what? Anger, aggression, hostility turned where? Inward, towards self, okay? So that's why number 1 is the correct answer. Next question. A client's hospitalized in a major medical client is hospitalized in a major medical center hundreds of miles from home for a bone marrow transplant. In preparation for the transplant, the client is in strict reverse protective isolation while undergoing total body irradiation and intense chemotherapy. The client's sibling, who has driven a great distance, comes to visit and has obvious manifestations of an upper respiratory infection. Which nursing action would be most appropriate at this time? 1, do not allow the sibling to visit and do not upset the client by mentioning the sibling's visit. 2, allow the sibling to wave at the client's window or door, then offer the use of unit phones so they can chat. 3, allow the sibling to visit after donning sterile gown, mask, and gloves, but prohibit physical contact. Or 4, allow the sibling to visit after donning sterile gown, mask, gloves, and have the client wear a mask. And I'll give you a moment to think of your answer. And so, guys, the correct answer is 2. The brother has an obvious upper respiratory infection. And remember, this patient's about to have surgery. Remember, surgery, what are we concerned about? DVT/pulmonary embolism, hemorrhage, and what? Ding, 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 infection. Okay? That is our concern. So the brother that already is showing signs and symptoms of infection, we are not going to let him into the room. But the patient still needs that family support, right? So we're going to allow the brother to wave at his sibling through the window and offer phones so they can communicate while they're looking at each other, okay? Next question. A client's been admitted to the hospital with a diagnosis of possible preterm labor. Which of the following tests would the nurse anticipate the physician ordering? 1, oxytocin challenge test. 2, a non-stress test. 3, nipple stimulation test. 4, glucose tolerance test. And I'll give you a moment to think of your answer. And the correct answer is 2, the non-stress test. Guys, it says that the diagnosis is possible preterm labor. That means that patient's possibly going into labor before time, before that 20 and 37 weeks, which we don't want. So we're not going to give that patient anything to make them start getting contractions. We're making those contractions stronger. So number 1, oxytocin challenge test. Absolutely not. What is oxytocin? Pitocin. What does Pitocin do? Cause contractions, which we don't want because the woman's in preterm labor. So we get rid of that. 2, nipple stimulation test. Guys, when a woman's pregnant, okay, and her nipple stimulated, what does that cause? Uterine contractions, which we don't want because this woman is preterm. So we're not going to do that because we don't want to cause contractions. And the last one, glucose tolerance test, they just threw that in there. That has nothing to do with contractions. What you're going to do is a non-stress test. Okay, that non-stress test gives you information about how that fetus is doing in the womb, the likeliness of that fetus to be able to survive without causing contractions, okay, without putting the fetus into distress. So that's why number 2 is the right answer. Number 2 does not cause contractions. All right, and we're at our last question. A client with schizophrenic disorder begins to talk about fantasy material. It would be most appropriate for the nurse to 1, encourage the client to focus on reality-based issues. 2, allow the client to continue talking so as not to interrupt the delusion. 3, ask the client to explain the meaning behind what he is saying. 4, persuade the client that his thoughts are not true. And I'll give you a moment to think of your answer. And the correct answer, guys, is 1, encourage the client to focus on reality-based issues. Always, guys, these patients that are schizophrenic, that are having hallucinations, that are having delusions, you always want to reorient them to reality, the here and now, okay? So when you walk into a room and you see that patient talking to the air because there's nobody there, but the patient's talking, you say to that patient, I don't see anyone. You don't say, you're talking to no one, because when you tell the patient you're talking to no one, you're blaming the patient. You're putting it on the patient. You don't want to do that in psych. You put it on you. You say to the patient, I don't see anyone. Or you don't say to the patient, I don't hear any voices. Not, you're hearing things. You don't say to the patient you're hearing things because you're putting it on them. You can't do that in psych. You got to put it on you, the nurse. You say to the patient, I don't hear anything. Okay, so you always want to reorient the patient back to reality and always tell them, I don't see, I don't hear. So that way you're not putting it on the patient. And guys, don't ever try to fight with the patient, try to persuade them, because what did number 4 said? Number 4 said, persuade the client that his thoughts are not true. You're just going to be entering into a power struggle with the patient, and you never enter into power struggles with patients. Absolutely not, okay? What you do is just bring them back to reality, saying you don't see something, you don't hear something, and you try to bring them back to reality. You don't allow them to continue talking about their hallucinations or delusions, because that will further strengthen their belief in what's really not real. Guys, I really hope that these questions were helpful to you. I hope that the way that I went over the wrong choices and explained them to you, I hope it was helpful. But guys, if it was not helpful, please put it in the comments. Let me know what I can do to better reach you guys. If there's anything that you want to see me cover, put it in the comments and I'll make sure I make a video for you. Thank you so much. Please do not forget, guys, if you want to keep the videos and the content coming, please be sure to subscribe to this channel and make sure you press that like button. Thank you so much, and I'll see you next time.